Hello, everyone. In these recordings of Chapter 21, we'll cover diseases of the cardiovascular system and also systemic disease. No surprise there, since the cardiovascular system is inherently systemic. There are a few terms that you should know and be clear about as we move through this chapter, and there are four of them listed here. First, septicemia is any infection of the blood that's producing an illness, and that can include the three conditions below. Bacteremia, which is often interchanged with the term septicemia, refers to bacteria in the bloodstream, while toxemia is specifically talking about the presence or release of toxins into the bloodstream, usually because of a bacterial infection. Lymphadenitis is what is depicted in this image here on the lower right-hand corner. This is an infection that, as you can see, is tracking along a lymph vessel, causing the inflammation that is visible. In common with these three are nonspecific types of signs and symptoms, but altogether occurring simultaneously will lead to the diagnosis of septicemia, bacteremia, or toxemia. These include a person suffering from fever, chills, nausea, vomiting, diarrhea, and a general feeling of malaise. With this, septic shock can develop rapidly, which raises the level of concern because that is usually accompanied by something called disseminated intravascular coagulation, which is abbreviated DIC right here. Disseminated intravascular coagulation is what it sounds like. You end up with small blood clots throughout your entire circulatory system, and as you can imagine, this can turn fatal. Petechia come along with this as well. We talked about this a bit with Rocky Mountain spotted fever. It's these small hemorrhages of the blood vessels that you can see underneath the skin as depicted here. Another possible outcome that can be very difficult to treat is osteomyelitis. This is when bacteria invade the bones. This becomes a difficult infection to get rid of since it's hard to get the antimicrobials to be effective down in the deep tissues of the bones. The signs and symptoms of toxemia can vary slightly depending on the type of toxin present or released. Recall that exotoxins are different than endotoxin. Exotoxins are things that are released from the organism as they're growing and dividing to cause damage to the tissue surrounding the site of infection, often connective tissue or white blood cells. Endotoxin is the other term for lipid A component of LPS, which, as you might remember, is something that you often find in the outer cell membrane of gram-negative bacteria. These are often opportunistic or nosocomial types of infections. You often see septicemia because the organism has been inoculated into the bloodstream through an injury, a wound, or a procedure. As the bacteria die off, and this can be in response to the administration of antimicrobials, the endotoxin is released, causing problems. Remember, too, that some organisms can resist phagocytosis if they have a capsule or other virulence factors that can play a role. If we remember back to when we reviewed microbial nutrition and growth, we talked about some of the trace elements that were needed in this process, iron being one of them. We have some proteins like ferritin that try to sequester iron away from the organism so they can't use it to grow. But organisms can have virulence factors that do capture the iron and pull them away from these proteins, called siderophores. Overall, for bacteremia, toxemia, or septicemia, it's usually a combination of educated guesses and of the signs and symptoms together that allow for a diagnosis. In less than half of the cases, you're able to culture organism from the blood or to make the identification. Makes it very difficult to treat, and hence being a condition with a high mortality rate of over 50%. This figure is illustrating the effect of endotoxin that I was reviewing a moment ago. endotoxin, or the lipid A component of LPS, has a lot of different effects on our system, and just a small amount can cause problems that will lead to shock and disseminated intravascular coagulation, both very dangerous conditions. You can see some of these pathways here. You don't have to memorize them, but you might want to remember some of the effects of LPS on our system, like inducing fever, causing intravascular coagulation, inducing blood clotting throughout the system, and inducing the inflammation because complement is being activated, all leading to shock and death. So endotoxin is something that's very toxic to our immune system. The gram-negative organisms that gain access to the bloodstream can induce this effect. Moving on to some of the diseases of this section, the first is endocarditis. This is inflammation of the interior of the heart. Again, the signs and symptoms of this are not too characteristic, except for taken together, the fever, fatigue, general sense of malaise, and tachycardia might lead to a detailed examination of the heart, and that will help the diagnosis of endocarditis. That will help the diagnosis of endocarditis to be made. One of the things to remember is that almost half of the time, this particular condition is caused by the viridins group of strep, which is mouth bacteria. Mouth diseases such as gum disease, abscesses, and infections within the mouth can lead to organisms entering the bloodstream of an individual and then cause endocarditis. Remember, this would fall into the category of a focal infection, a localized infection that's a source of another infection. Therefore, when people have endocarditis, one of the places where the physician should be looking for clues will be in the mouth of the patient. If problems are found, those also have to be resolved, otherwise it's going to cause a reinfection. Alternatively, there's usually some other obvious source or site of infection, and similarly, the organism gets into the bloodstream and settles into the heart. Once in the heart, one of the things that organisms do there are create hideouts for themselves. These are called vegetations. What's going on at these sites is that the organism will coat itself with components like blood platelets and clotting factors to hide from the immune system. Think of it as a camouflaging to look like self. These vegetations can break off and get lodged in blood vessels. That's an embolus, or emboli, plural. So how do you treat this? With antimicrobial drugs, usually at fairly high doses and administered intravenously. Who's at highest risk for this? People with heart problems. These individuals can be treated with prophylactic antibiotics, for example, before dental treatments. This preventative use of antimicrobials helps kill off any bacteria that may get introduced into the bloodstream because of the dental work, before the organisms have the opportunity to lodge in the heart. This next disease to be discussed is usually of great interest to students because they have learned about the devastation it can wreak in other courses. Black Death, or bubonic plague. You heard of it? Bubonic plague and pneumonic plague are two forms of the same disease. They're characterized by inflamed lymph nodes, which we've talked about before with cat scratch disease. This is a bubo, a very painful, enlarged lymph node. That's where the name bubonic plague comes from. It also has the nickname Black Death because, as you can see from this image, we have necrosis of tissues at the extremities. After subcutaneous hemorrhaging, a type of gangrene sets in, and this leads to blackening of the skin. These characteristics, along with disseminated intravascular coagulation, are all diagnostic of the bubonic plague. And as you probably know or have read, it caused huge pandemics back in the 14th century in Europe, and about a third of Europeans died during these raging pandemics. You think COVID created havoc? Think about a scenario where 1 in 3 people succumb to the pandemic sweeping the nation. The organism is a gram-negative bacteria, Yersinia pestis. And it normally infects rodent hosts like rat, mice, and even prairie dogs. When it is transmitted from rodent to flea to human, it's the bubonic plague form. If a sick individual is coughing and spreading the infection via the respiratory route, it's the pneumonic plague. That occurs when the organism has spread to the lungs. The pneumonic plague is even more deadly than the bubonic plague, and it may have something to do with infectious dose someone's exposed to, as well as the portal of entry affected first. If you don't get treated, the pneumonic form is almost 100% fatal, and the bubonic is about 50% fatal. If you're exposed nowadays, however, you can get treated with antimicrobial drugs to prevent getting sick or get better once you start to get ill. In modern societies, we try to control the rodent and flea population to prevent being exposed from the disease because it is actually endemic. You can see that here. In the United States, there's been cases, and although they're not rampant, they are present because we have natural rodent endemic hosts. So if you go hiking up to the mountains, sometimes you see "don't feed the squirrel" bubonic plague signs. We know the organism exists and you need to avoid exposure. You can see the life cycle in this image. Rodent endemic populations are infected, so the normal cycle with this endemic population occurs as a flea feeds on the infected animal and then feeds on another animal, passing the infection to promote the cycle. But if a flea accidentally bites a human, it leads to bubonic plague. And if that individual becomes infected in the lungs, it becomes pneumonic plague, and they can spread it via the respiratory droplets. As previously mentioned, the pneumonic plague is much more deadly, probably due to the amount of organisms that you're exposed to at the initial infection site, the lungs. The last disease of this particular video is Lyme disease. It's presently one of the most reported vector-borne diseases in the United States. And this is in part because humans have moved further out into natural habitats, natural woodland areas where these organisms have been existing within their animal reservoirs for quite a long time. Also, a factor is animal reservoirs for this particular organism and infection, like deer, foxes, and mice, move into the areas that humans populate. When you have situations where mice populations increase because of their natural predators like foxes have been displaced, then we've got a perfect storm of conditions to spike Lyme disease cases. Again, the diagnosis for this disease is going to be on the signs and symptoms, or the patient's serology, which is usually made with the help of a Western blot. The best outcomes from the patient have been if you're able to treat in an early phase of the disease. But there's been plenty of evidence that if you start treatment much later because of a delayed diagnosis, then the individual often has a lingering effect. And the hypothesis for the moment, the lingering long-term effects of Lyme disease infection may, to some degree, be due to damage to your system caused by your own immune response to the infection. To minimize exposure, you must prevent getting bit by the infected ticks in order to avoid the infection. The organism is a spirochete, which would look like the organism that is shown in this image. It's caused by the spirochete bacterium Borrelia burgdorferi, named after the researcher who actually figured out how to grow the organism in the lab, William Burgdorfer. It can avoid the host immune system by various different mechanisms, like antigen variation, meaning that it changes its membrane proteins and therefore the way it looks to our immune system. By switching epitopes, the immune response can't eliminate the organism. It also avoids the need for hiding or sequestering iron by using other ions instead, and avoids using some of the common enzymes that would normally need iron ions as a cofactor to function. The deer tick, Azodes tick, is the biological vector, and mice and deer are reservoirs for the infection. Interestingly, a vaccine against Lyme disease was introduced, and it was pulled again in 2002 because some patients were experiencing disease-like symptoms after the vaccine administration. So in abundance of caution, it was pulled off the market, and there has not been a Lyme disease vaccine reintroduced since. You can see that while Lyme disease is present in most of the United States, there are definitely hot zones for the infection. Now here's the life cycle. Brand new tick larvae are hatched from eggs. They're not infected. The larvae become infected when they feed on infected deer mice, which are reservoirs for the infection. Once they feed and molt, they become nymphs. Nymphs are often the stage that feed on humans on accident. They bite and take a blood meal, infecting the person. You can see that the tick is actually very small in its nymph form, and therefore hard to realize that you have a tick attached to you that could be transmitting the infection. Once they infect humans, they often will cause the individual to develop a characteristic bullseye rash. Not surprisingly, it's called a bullseye rash. However, this is not always present, and it does not always look like a bullseye. Sometimes you only see that central red area. But the bullseye rash, if seen, is definitely a diagnostic sign for this particular disease. After the blood meal, the nymphs molt and become adults. The ticks normally feed on deer, not humans, and then they molt again and become adults to mate, feed again, and lay eggs. Here are just some images to help you remember those diagnostic clues for the disease. Here again is a bullseye rash, some spirochetes, and the 3 stages of the tick next to a head of a pin as a size reference so that you can see how small they are. This nymph is actually the stage of the tick that passes Lyme disease spirochete to humans. This is where we'll stop this first video. The second video will pick up with mono or kissing disease.